Hey there, it's Dr. Jim. Thank you for stopping by and spending a little bit of time with me. I've got a good topic. It's another COVID-19 topic because we're just not through this yet. And I found this to be important and practical. So it's crisis management during COVID-19. So let's talk about that for a little bit. We're experiencing a viral outbreak like no one has ever seen before. With it comes a lot of fear and anxiety that can further disrupt operations in delivering medical care in various healthcare settings, including hospitals, nursing homes, assisted living communities, home health, and hospice. COVID-19 is making an already stressed system even worse, okay? Now, more than ever, and I think you're going to agree with this, leaders need to rise to the occasion and deliver real and effective crisis management. We are in a crisis. Crisis management, though, begins with correct information, not bad information, not misinformation, not conspiracies, okay? Someone once said, knowledge is power, but not all knowledge is the truth. Wow, that's a great quote. Knowledge is power, but not all knowledge is the truth. This could not be more appropriate during the coronavirus outbreak. Crisis management involves getting employees to understand the facts as they are currently known, and they're going to change, and to fully accept them as they are. You know, it is what it is. This is what we're dealing with. Let's go, okay? So since new information emerges rapidly and the situation is sure to change over and over again, leaders must stay on top of the latest information and the most relevant things for their team. Now, what is one of the most necessary components of crisis management? Being as flexible as possible. Rigidity does not work in a fluid situation. Crisis management requires everyone to remain flexible as possible because crises, by nature, are fluid. As new information is made available, it's important to evaluate how effective current methods are and determine if they need to be changed based on incoming information. In other words, we're doing it this way. Let's evaluate the outcomes. Are we doing it right? If not, switch it up. So, flexibility also requires reevaluation of how jobs are performed, the types of equipment that are needed, and how care is delivered, even where care is delivered, and the equipment that is used, and the PPE. I mean, all of this stuff is so important. The direction employees take one day might change within hours or tomorrow. Therefore, it's necessary to accept changing directions and perhaps many times. Truth and honesty, 100% necessary in crisis management. You're not going to sugarcoat anything here. Hiding facts and information from employees like a real crisis that the COVID-19 outbreak is completely unacceptable, and it's not wise whatsoever. Being deceptive in general destroys truth, and in times like these, times of crisis, it might cause panic. Leaders have a responsibility to share clear and concise information and being genuine and transparent as possible. Those are very important things, okay, to think about. Now, it's good. Look, we've all been trained for the most part, I think, in this audience, on universal precautions, on reducing cross-contamination, on reducing risk for bloodborne pathogens, airborne pathogens, so on and so forth, right? We've had training. Here's an important point in crisis management. Rely on previous training, but anticipate the unexpected. Nobody saw the virus moving beyond the Wuhan, China region to infect virtually every nation on the planet Earth, and yet it did. Prior to this outbreak, Healthcare professionals received routine training, education, and drills on a variety of areas like universal precautions, infection prevention, flu outbreak, reducing cross-contaminations, and dealing with fires and floods and severe weather and disasters. Maybe we should add dealing with epidemics and pandemics to that annual list of mandatory training topics. I know nobody wants more mandatory stuff, but this one might be important because it can come back. It most likely is going to come back. Cold and flu season will now probably become cold, flu, and coronavirus season. So, despite the training, healthcare professionals need to be ready to handle things that they are not prepared for. Crisis management also means managing people. Crisis management involves managing employees who are all very different, and they're going to react in a number of ways under extreme stress. Staff may exhibit emotions they normally would not under normal circumstances. During a crisis, though, it's important for a leader to be empathetic and support their team, especially the direct care staff. Patience during a crisis is a must. So is accepting that everyone is different. Okay? We're all not going to react the same way. What are needed, along with these other areas? Early action, mindfulness, and appreciation. Don't forget those. Effective crisis management requires immediate and decisive action because once a crisis has begun, it will remain in motion. It's like a snowball going down a hill, and it's only going to get bigger and bigger and bigger unless you stop it. Okay? It's equally important to practice mindfulness during a crisis, meaning that leadership and others will be fully present for good or for bad, and focus on the here and the now. I don't know where we're going to be a week from now. I know what happened a week or two before. We are in the now. They will also keep in mind that everything will eventually pass, and operations and care will continue long after this virus is dealt with. Every storm passes. Everyone on the team will be working long hours, standing on their feet and doing their best. Some will become stressed out, depressed, anxious, and others will show great strength and great resilience, regardless of their emotional reactions. It's important for leaders to constantly show appreciation, gratitude, and share their feelings about the situation. So, here's some final thoughts. COVID-19 has caused massive disruptions in almost every industry around the country and the world. Healthcare is no exception. The virus has made providing care and delivering much needed services to an already vulnerable and susceptible population even tougher. Leaders need to deploy their crisis management skills today, now. Although this is a challenging and frightening time, better and more well-prepared leaders will emerge to take on the next crisis, whatever it might be. Thank you for spending some time. We're in a crisis. Get as much information on crisis management as you can. Keep learning and managing your staff as best as you can. See you soon.